Non-small cell lung cancer is responsible for about 85% of cases of lung cancer. Lung cancer is a very common malignancy, and in fact, lung cancer leads to about the same number of deaths as the next 4 malignancies combined. The treatments have improved somewhat over time, but in patients who are diagnosed with metastatic non-small cell lung cancers who have progressed during or after therapy, meaning that their disease has gotten worse during their initial therapy or after they have completed their initial therapy, the outcomes for additional treatment have been quite poor. What we did was evaluated whether we could add a second drug, a drug that blocks the formation of blood vessels called ramucirumab, and add that to the standard chemotherapy. And what we found when we did that was that patients who received the 2-drug combination lived longer than patients who received only the single drug. Ramucirumab, which again goes under the trade name Cyramza, is a drug that blocks the formation of blood vessels. Blood vessels are necessary to bring oxygen and nutrients to tumors, just like they are necessary to bring oxygen and nutrients to other tissue in the body. And the idea is to basically shut down that delivery of oxygen and nutrients to the tumor. The addition of ramucirumab to the standard therapy led to improvements in both the number of patients who responded to therapy, the duration of time prior to cancer worsening, and the duration of survival amongst these patients. This is the first time that we have, in a broad population of patients with non-small cell lung cancer, been able to improve their survival with the addition of a new drug to second-line therapy. This is a very exciting time in cancer research. I think as we have learned more about what goes on in the cancer cell, we have improved our tools for studying cancer. Some of the observations that have typically been restricted to the laboratory are now ready to be applied in the clinic. This is a major public health problem. One thing to take heart in is that there is a great deal of research that is ongoing, and that patients who are interested could look for clinical trials as a component of their care, even early prior to receiving any other treatment in some cases.